Hi, everyone. And it is really amazing to do something on Veterans Day, which is a day where we show gratitude and I hope love and action to honor those who have served our country and who are serving our country now, and how we help support them and how we help strengthen them. And so we thought no better a day than to have the continuation of our Vital Lessons series, um, talking today about caring for veterans, families, and communities. Yes, let's see a lot of love for veterans. And we had, by the way, we did, for those of you who are not on Share My Lesson, we did some social media today on the kind of curriculum work we have in Share My Lesson about Veterans Day. Thank you, Kelly Booz, who also helps us do this series. So I am really, really honored today because this series is basically, Dr. Vin Gupta and myself every month talking about some issue of common concern for people in America, particularly for our members in the communities we serve. But one second, the door is not closed. And but this month we have, as I said to them beforehand, my two favorite doctors in life, which is Dr. Gupta and Dr. Redlener. Now, Irwin, and I say this with my knowing that my own family, my sister is an intensive care pediatrician, and my brother-in-law is a radiologist. But so I'm going to get in trouble with a lot of people, including all the members we represent to our doctors. But what I really admire, and look forward to in talking to both Dr. Gupta and Dr. Redliner, and Dr. Gupta will join us first, and is that they understand the medicine and they understand how to communicate with mere mortals. Those of us who are not in medicine, those of us who are not in healthcare. Yes, I represent a lot of people in healthcare, but I don't start myself as in healthcare. And for most of us mere mortals, um, any experience in the healthcare system, particularly if we are sick, is hugely anxiety producing. And when you have someone like Dr. Gupta or Dr. Redliner who actually can not only know their stuff, but can talk to us in a way that we can hear what they're saying, in a way that we can rely on their advice, that is really, really, really special. And on top of that, sorry, I'm stammering, they both hugely care about public health and the common good. And we've relied on both of them in so many different ways, from that talking about vaccines to children's health to what happens in COVID to now today. What do we do, and how do we need to care for our veterans, families, and communities? So that's what we want to do today. We're gonna we're gonna talk about things like mental health and well-being. I mean, I'm sorry, we've talked about mental health and well-being and vaccines and preparedness, but what we're going to do today is really talk about how we strengthen the systems of care around us so that every veteran, every family, and every child has the chance to heal and to thrive. And this is particularly important as the shutdown is ending, because we are fighting for new VA clinics. We are fighting for actually expanded telehealth, more appointments, outside of traditional hours. We're fighting to make sure that the staff shortages, the problems with access to timely care in rural communities, the problems in terms of mental health, that they do not that we deal with these problems, and we're doing this at a moment in time when I credit, sorry for being political for a minute, when I credit the Democrats a lot for making sure that the healthcare issues remain front and center, healthcare issues that all working people have, but particularly people who are on Obamacare, to not have skyrocketing healthcare premiums when the tax credits run out. But we need, I know many are disappointed that the Democrats didn't get the healthcare changes as the government was reopening, that there is still a real issue in terms of healthcare, and that a vote on it is not the same as an agreement about it. But let me be clear, we will keep fighting for affordable quality health care, and we will keep fighting for the Obamacare credits to be there, and we will keep fighting to reverse the Medicaid cuts, and we will keep fighting for all of these affordability issues. That is a promise I can make on behalf of the AFT, and we will be relentless every single day fighting for the kind of dignity, opportunity, and affordability that everyone in America needs, particularly not only our members, but those we serve. So today I'm going to introduce both Dr. Irwin Redlener, who is a national expert on disaster preparedness and humanitarian responses to it. And Irwin co-founded the Ukraine Children's Action Project, which I joined him in Ukraine for an amazing session several years ago in Lvov with many teachers, but they are now supporting 25 initiatives helping children displaced by the war. And he founded the National Center for Disaster Preparedness at Columbia University, and he still advises so many of us about how to prepare for and recover from crisis. And then there's, of course, Dr. Vin Gupta. Now, Vin is not only a physician, a pulmonist, and a professor, but for some who don't know, and this is part of the reason we wanted to do this on Veterans Day, he serves as a major in the U.S. Air Force Reserve Medical Corps, and he has deployed as a critical care aerospace physician with the, let me see if I can get this right, the 446th Aerial Medical Staging Squadron at Joint Base Lewis McChord. And so he also is so involved in strengthening emergency health responses. And so, Vin, what I wanted to do is turn it over to you in terms of just starting this conversation with Irwin. I'm going to call them by their first names today, in terms of what we want to do today, first on veterans, but then also their families, their kids, their communities, and how we stay connected to them, and how we also make sure that they are protected and cared for in our country.
Randi, thank you as always. For everybody out there watching, and we always, as always, we share this in the digital space. We syndicate all these town halls. I do want to encourage everybody, I'm already deep into this, to get Randi's new book, Why Fascists Fear Teachers. It's a heck of a read, Randi. I'm going to put this up here. You can get it under 24 hours. That. Absolutely. Yep. It's right on my right in my background here. But but Randi, thank you. This is a really important topic. I'm grateful to have Dr. Redlener, a colleague across dimensions, join us for this conversation. But I just want to say for everybody that is joining us live across the country, and for those that are going to watch this later, since we clip these town halls up, These are national public health town halls. We've been doing them since March, and we wouldn't be able to do them if it were not for Randy's willingness and vision to support this. And so Randy, as always, I mean, I should say, to toot the horn of AFT, and Randy, your team, Kelly Booz, Kelly Nidro, you, of course, at Vital Lessons recently was recognized by the Academy of Digital and Interactive Sciences, which I didn't know that academy existed, but essentially they award the very best in digital media across the country, and we got a gold medal for this work, informing people as a public service. And so I think there's real traction here. We're not just doing it. I should say for everybody, we're doing these monthly. Randy and I we're trying to do every few weeks Instagram Q&As. The goal is to have Irwin back in December to talk all things pediatrics. Irwin, you don't know that we're going to ask you for that, so hopefully that's okay.
Of course.
But we've been talking about measles with the head of the American Academy of Pediatrics. In April, we had Dr. Jerome Adams talk about youth mental health and ADHD. In May, we had a great conversation on perimenopause awareness between Randy and two leading obstetricians. In June, Dr. Mandy Cohen talking about longevity. July, Dr. Peter Hotez and the Autism Society really debunking myths on autism. And then we had senior leaders at CDC and then former New York City Health Commissioner Dave Chokshi talk about back to school safety in August and September. So I think there's a lot of momentum here. And the goal here is to platform the very best healthcare leaders with me and Randy, since those healthcare leaders are not currently at the very upper echelons of the federal government, which is why I'm so glad to have Dr. Redlener be our partner here today. Irwin, thanks for joining us.
My pleasure, Vin. Thank you.
I wanted to, just to start this conversation off, reflect on why we're here today, Veterans Day, and just make sure that we're not losing sight of key health topics as it pertains to our military community and veterans' health. I think sometimes we do these pro forma conversations every year on this day, and it doesn't feel fresh. I don't know if it necessarily advances an agenda. There's so much noise out there. So I think I'm going to start there. I'm going to then bring Irwin in, and because we're going to make this a holistic conversation, take a broader view on veterans' health and really think about their families as well. And Irwin is one of our nation's top leaders when it comes to understanding the secondary impacts of war on communities, on families, on children's health. And so that's why we're really thankful to have him to broaden the conversation. But before we get there, I'm just take a moment or two to talk about where we're at. I should say that, actually earlier today for broadcast media, we did a segment for MSNBC that we'll put the link to in the one pager that we do after these town halls. But it was on the use of psychedelics, or the emerging use of psychedelics like MDMA, psilocybin, others. So very uncommon, not sort of options that we would think about using for conditions like treatment-resistant PTSD or treatment-resistant depression or anxiety. But now we're seeing a lot of meaningful action started by the Biden administration and the VA under the Biden administration, to some degree continued by the current administration, but not, I think, with as much intention and thoughtful consideration. And a lot of leadership out of California at the state level with Governor Newsom. We're seeing that there's an acceleration to study how these psychedelics, how this potentially new category of treatments that are highly regulated could actually be utilized to help veterans dealing with very difficult to treat PTSD from, say, combat, or a deployment that had a lot of trauma associated with it, or a traumatic brain injury that we know can then cause a significant amount of PTSD. The reason I bring this up is, I do feel like we tend to talk about veterans' health in the same terms every year. By we, I think the collective public discourse, not this Vital Lessons partnership that we're doing with AFT. The effort here is to break through the noise and try to take a different view on things, and hopefully to drive meaningful policy change. But when we reflect on what is driving the greatest disease burden amongst veterans, it's by far and away it's mental health, but treatment-resistant mental health conditions, difficult to treat depression, anxiety, PTSD, substance use disorders like alcohol use disorder related to PTSD, I think a secondary cause. or secondary consequence of PTSD is substance use disorders. Now what we're seeing is hope on the horizon, that psychotherapy coupled with antidepressants that isn't working for up to 30% of veterans that are plugged into care but are just not making progress. And so what did Governor Newsom just do 3 days ago? He and his team actually cut a lot of the red tape that is often saddles this space. Because these are very highly regulated, I hate to call them drugs, but substances that can really cause alterations in your brain perception and brain activity and just kind of your ability to cognitively function. Psychedelics can be very unsafe if not used properly, which is why they're highly regulated. But it seems like under the right circumstances, with the appropriate clinical direction, the right dosage, and proper oversight, psychedelics can be used safely to treat difficult to manage PTSD. We actually saw a great study out of Stanford a few months ago, show that there's an 88% response rate to the use of psychedelics amongst special forces veterans that were not responding to usual care. 81% reduction in reports of anxiety in that same cohort. And so, and that's just one example of high quality research that I think is really showing us that we need to be thinking differently about this disease state. We need to be thinking differently about how we especially treat veterans that are disproportionately impacted by difficult to treat PTSD and anxiety. It's often said that on average, more veterans die of suicide every single day on average than those in cumulative in total died on average daily from combat deaths. When you add up the number of combat deaths in Vietnam, Afghanistan, and Iraq, the average daily death toll from combat deaths across those three wars is less than the number of average suicides amongst veterans every single day. And so it's a big deal. And I think it's really encouraging that we have a different way to think about treatment. Other things to think about that I'm sure will come up: physical health issues, chronic pain. If you or a loved one are a veteran, or if you know a veteran, or if a loved one's a veteran, chronic pain is a big issue that can precipitate pain medication overuse, and that can start the cycle of a mental health disorder that really is a vicious cycle here. TBIs, traumatic brain injuries, problems linked to memory, to mood disorders, cognitive decline. Again, vicious cycle here. Are they plugged into care is the question. Often, at least we saw until the Obama administration really took this on with the Mission Act, which basically allowed veterans to seek care from a private provider outside the VA system if the VA system couldn't manage their care, whether it was a TBI, whether it was a chronic pain issue, whether it was a mental health issue. Up until then, a lot of these issues continued to get unaddressed. And so we would say delayed diagnosis, delayed treatment throughout the especially sort of post 9/11, throughout the 2000s, into the early part of the Obama administration until the Mission Act was passed. We saw a lot in the way of undiagnosed, untreated disease burden, musculoskeletal injuries, exposure-related conditions, burn pits, Agent Orange, Gulf War, exposures during the Gulf War, have led to a variety of respiratory conditions. Again, delayed diagnosis, delayed treatment, up until recently, where I'm starting to see, and I'm seeing this with my own eyes, having a pulmonary clinic in the VA here in the Puget Sound, but also from hearing this from colleagues that practice across the VA, that they're having an ability to care for their veterans using a whole of community approach. It's not just, gosh, we got to plug them into care at the VA, and if that doesn't work, we have to make them wait in line for 6 months. No, they can actually go to a private medical clinic or center, or the academic medical center down the street and get care. I'm going to close just by touching on a few things here. Oh, sorry. I think I heard somebody, or maybe not. Just to close on making sure that we're holistic on this, and I want to bring Irwin in. Cardiovascular disease and aging-related issues. We are seeing a predominance. I see a lot of this, unfortunately. Chronic vascular disease, chronic cardiovascular disease amongst veterans because of delayed diagnosis and treatment, because access to basic primary care was delayed for a lot of their life after their service time. Again, all of the 2000s into the early part of the 2010s, we saw a lot of delays in access to basic care that are finally getting addressed, I think. But now we also have potential barriers to care that are being introduced by the current administration. So let's see how that all plays out. But cardiovascular disease, diabetes, obesity, high disease burden. And then I should mention, homelessness. The veteran population sees a disproportionately high rate of homelessness relative to the general population. There's reintegration challenges. Can they get durable employment outside of the military infrastructure? And is that something that they are trained to do? Often, I work in my reservist capacity. I work with some active duty colleagues that have tried to branch out into the private sector or into the private world outside of the military ecosystem, and they just find it really hard. And the culture is different. They're not used to it. They don't feel like sometimes they have the skill set to have a job or hold a job outside of what they know within the four walls or sort of the compound or fencing of a base. And I'm not sure we've really cracked the code yet on how we help with integration or reintegration into non-military society. So I think those are some of the issues that are top of mind. I will say in terms of, as we talk about solutioning, because I do want to focus a bit on that, there are solutions here that we're seeing. Again, psychedelics for difficult to treat mental health disorders, great. Mission Act, we're seeing a greater ability of veterans to be able to access basic primary care in their communities. And then telehealth expansion. We're actually seeing VA Video Connect and mobile mental health apps allow veterans to be able to connect to care within the comfort of their own home, which is fantastic. So there's a lot there. I'm sure there's going to be a lot that we get to. We're going to be providing a one-pager, as we always do, and clipping out this town hall just so you have access to snackable information coming out of this. But Irwin, I want to bring you in. Thanks for tolerating all of that.
No, pleasure to hear.
I'd like you to build on, we often think about Veterans Day as let's honor veterans and their sacrifice, which I think is obviously very appropriate, draw attention to issues predominant in the veterans community, especially when it comes to healthcare. But I think you do something so beautiful, which is you really tell the broader story of families and how they're impacted by war, or if those families maybe not even be involved in the military, but live in a sort of a wartime setting. All your work in Ukraine as an example. Help build this bridge for us. Describe to us the impact that war has on families.
So, Vin, thank you very much. I actually thought I really appreciated your comments initially. And I first of all, a personal observation. I am a pediatrician, and I have been, I can't reveal how long, but it's a really long time. And I'll tell you, one of the things, even as a doctor who has been taking care of children for many years and developing programs that take care of children, I have never been happy about how we've treated veterans that have defended our country, have fought for us, have died for us, have survived with problems. I think it's one of the things about the United States that that I became aware of really during Vietnam, and I was a active opponent of getting involved in the war, but I always felt that it was just a horrible thing that we did in not really honoring the men and women who served us then and now. And I think we really do need to pay more attention to the health and well-being of veterans. And the second point, of course, Vin, is really what you just said. Veterans and people in the military have families. Almost 50% of veterans have children. And nobody that is in the military that has children should be looked at as in isolation with respect to their families. And actually in pediatrics, several years ago, we started thinking about children not as just isolated little people, but also as members of a family unit. And we had to be appreciative of what the dynamics were between kids and their families. Can we go back, please? Don't. I'll let you know into advance, Kelly, if you're doing that. Okay. And I want to just spend a few minutes talking about the dynamic of the children, both of soldiers who are active fighters and the children of veterans, because really both of those topics are germane to what we're talking about right now. First of all, as Vin said, my wife Karen and I co-founded an organization almost 4 years ago now that is helping children and families cope with the impact of a very terrible, bloody war in Ukraine that was really entirely due to an unwanted invasion of a massive force of Russian military. And if we can go to the, where are we here? I think there was a map before, yeah, that. So what we have now in Ukraine, and Karen and I just got back from our 8th trip to Ukraine. We've raised at this point close to $8 million and are now supporting about 45 programs that are helping children impacted by the war and helping them in terms of what they're experiencing, which is educational disruption and a significant amount of psychological trauma, as well as physical consequences, including fatalities and serious injuries. That's about 3,000 children that have been actually injured or killed in the war since full-scale invasion in 2022. About 1.5 million kids are suffering from some sort of psychological trauma, many of them in actual post-traumatic stress disorder, and at least 1 million to 2 million children who've had their education disrupted. So the children are impacted throughout Ukraine, even though the war fighting is over there. When you're looking at the slide in that orange area where the front lines are, where the Russian troops have occupied now about 18 to 20% of the entire country of Ukraine, there is just straight up violence. And a lot of kids are actually caught in the crossfire. Do the next slide, please, Kelly. And what this means is that for families that are in the active battleground zones, we're obviously dealing with very, very extraordinary amount of danger. And families have had to make a very critical decision about whether they're going to try to remain in some of these cities that are really part of the active war fighting, or are they going to try to leave? Whether they leave and become displaced families with children, or they try to stay in place and stay safe. This is a highly threatening and difficult, disruptive situation for children. Next slide, Kel, please. And the first thing we did the first time we went in the spring of 22, we stopped. You always have to stop in Warsaw. Of course, you can't fly into Ukraine during war, but we saw thousands and thousands of these refugees. Families with children, and obviously the men stayed behind. They are part of the war fighting for Ukraine, but the moms and kids, many thousands, and ultimately more than 5 million people from Ukraine evacuated to Poland and other countries, and even that is extremely disruptive. Children were going to school. Children had friends and activities in their communities. The normal activities of childhood get suddenly disrupted, and then they find themselves in a very strange, difficult environment with little to ground themselves in a new life, and it's been very, very difficult. Next slide. And the country of Ukraine itself is under an incredible amount of stress, and not just in those areas in the south and the east where it's occupied. You probably have read that some 20,000 Ukrainian children have been abducted and taken back to Russia. 20,000 Ukrainian children would be the equivalent of about 150,000 American children kidnapped by a foreign adversary who's invaded a fifth of our country. So this has been a horrifically painful reality for Ukrainians. So for the people that are the civilians who are not necessarily fighting on the front lines, who are not in the military, the families and the children of all the war fighters and everybody in Ukraine is affected by this being a country at war. Next slide. And the point is that when a country is at war, children are always impacted. There's anxiety, there's fear, there's displacement, and there's grief. There's been somewhere between 50 and 60,000 Ukrainians killed. Most of them are killed in military service, but as you probably have read, the Russians have continued to rain missiles and drones upon cities and areas throughout Ukraine, including in the westernmost regions, which you might think are safe, but which are not. When we were there last month, we got there a day and a half after Ukraine was hit by 500 drones and several dozen missiles. And I was taken to some of the sites where just plain old regular neighborhoods were actually targeted by Ukraine and by Russia in Ukraine. And the Russians also have destroyed, you may know about this too, Randi certainly is aware that more than 1,600 Ukrainian schools have been targeted and damaged or destroyed by Russians. So the point is, if we just go to the next slide, the thing that is so important to understand for children who live in a war zone, whether it's the Middle East or Sudan or anywhere else, and especially in Ukraine now, this loss of normalcy is a horrendous reality that children and families have to deal with when their country is at war. And this is why we've been able to raise a fair amount of resources and are helping children that are impacted in the variety of ways I just mentioned. But next slide.
Irwin, can I ask
Yes,
while we're going to the next? No, this is great, and I think this gives a different flavor for and focus for Veterans Day. How are you noticing how family health and veteran well-being are interconnected? Are there ways in which, if you support a veteran?
Yeah, I'm coming right. Here we go.
You're getting to that. Okay,
this
perfect.
Slide, Vin, if you look at this, So thank you for the segue. So what we have, I mean, the reality of this is that veterans of any war, whether it's Ukraine or the United States, have, as we said, they have children. Half of the veterans do have children. And this is the principle. If a parent is suffering, the child is suffering also. The kids are impacted by the issues that we're observing in their parents who are veterans. So if a warfighter comes home and is depressed, or maybe has post-traumatic stress disorder, or maybe even is suicidal, the impact of that ripples dramatically throughout the family. Kids are not immune from the consequences of a loved one, and especially their dad or mom being impacted as well. And the implications for us is that when veterans get care in America, and I'm specifically talking about veterans who have actually been warfighters in combat or in or near combat, this is something that we have to pay attention to. And I do think that that we have to pay attention, even if we're providers in the VA system. We have to be asking about and responding to the issues that are affecting the veteran's family. And this is really important. And beyond that, if we can go to this last slide, teachers in classrooms where there are children whose parents have been in war, who have been fighters, who may be suffering from these mental health issues and stresses that we're just talking about. Teachers need to know how to recognize that this little boy or girl may be feeling the impact of the family that is trying to cope with the veterans' suicidal tendencies or severe depression. And the more teachers are aware of the dynamics that are happening in the classroom with children, the children of veterans, the better they'll be able to appreciate what they're dealing with and help make sure these kids get the help that they need. So I'll stop there, Vin, and if there's questions or comments, I'd be happy to hear from anybody.
Absolutely. I am just making sure I'm scanning here. Thank you, Irwin. Irwin, I'm wondering from your standpoint, you're obviously doing all this incredible work and you've raised an incredible amount of resources. I see you advocating and doing a lot of great work, bringing attention to this work, on MSNBC and other channels as well. From your standpoint, what are the things that we can apply from from your experience in Ukraine, what you and Karen are doing? What are we not doing
Yeah.
here
So
that you're
one of the
doing
things
there?
that
Yeah.
Right. And actually, there are some things that we're doing that I think are really applicable. And we actually have worked with Randi and the AFT and the teachers union in Ukraine as well, which is to develop an online training program for teachers to take to help them recognize the signs of a child who is suffering from something going on in their environment. Either in the case of Ukraine, it might be, and obviously often is, the fact that they have, teachers are looking at kids in their classrooms who have been impacted severely by the war that's going on in their country. And here, if we see children whose behavior is acting as a red flag that something might be going on with them. They're not paying attention. They may be falling asleep in class. They may be exhibiting new evidence of hostilities or aggression to other children. This kind of training program, so teachers become more sensitive to what might be happening psychologically, dynamically in their classroom would actually be a step that's very concrete and really could be taken in communities where there are significant presence of veterans.
Curious also, we talk so much about mental health. I spent a lot of time in the tee-up talking about new treatment options. What's being done? What have you seen being done when it comes to dealing with trauma, PTSD, in global conflict areas that you led the disaster response and preparedness center at Columbia for a while. You're now doing this incredible work in Ukraine. In the US, it feels like, now we're talking about psychedelics, better ways, for example, to access care, tele-triage, the suicide line. There's the 988 Veterans Crisis Line. And yet it still seems like none of this is having a significant impact quite yet. Have you seen solutions when it comes to dealing with suicide risk, mental health issues amongst family members of veterans that we should be co-opting here in the United States?
Then whatever is happening for adults, for the veterans themselves, is multiples times more than is happening for the families of veterans and the children of veterans. I'm not even aware of many effective programs or enough programs to make a material difference for these families. I think veterans are getting inadequate treatment, and I think the families of veterans, basically, to put it another way, are getting even less access to care and sophisticated means of dealing with them. Don't forget, we have a huge shortage of children's mental health specialists in the United States. It's crisis level and has been for a very long time. So even if a teacher, for example, picks up signs that are worrisome in a kid in the classroom, and brings in the parent to talk about this, and the parent says, yeah, we're dealing with a lot of stress in the family. My spouse is highly depressed, just got back from a tour of duty, whatever it might be. You can't just say, well, just call up your local child therapists and see if you can get treatment, they don't exist. So people will go to the pediatrician. Pediatrician may or may not have the slightest inkling about what to do with kids that are suffering from mental or emotional stress. And
Right.
there's a shortage, as I say, of people who can. So it really is a crisis right now.
I do want to just layer on, and then Erwin, we have a few more questions for you, and then Randy, please interrupt me at any point, Randy. Um, just for our audience, and then for those that will watch this
I
later.
will. I've just been enjoying it.
Um, real quick here, just so everybody knows, and I'm going to kick it over to Randy. Um, so here in the United States, it's Veterans Day in the U.S. Just to bring it back to what you can do, or if you have somebody that you know is struggling, and they're a veteran, or if they're a family member of a veteran, 988 Veterans Crisis Line. It's immediate access to trained responders, 24/7. 988, important. There's peer support programs that are getting invested in. And it appears that the current administration is not going to hopefully roll this back to any significant degree, but this veteran to veteran mentoring, vet centers across the country, which are located in VAs, but this is the peer support programs that you can probably get access to through your local VA for mental health. It's kind of a different way to seek counseling therapy, and it's veteran to veteran peer support. There are other models out here. We've seen a lot in the way, again, of telehealth expansion for veterans to get immediate access to care, whether it's for depression, anxiety, PTSD, or say you have you're a diabetic and you're not under good control. VA Video Connect, something to ask your VA provider. VA Video Connect, really important. And it's a good way to get plugged into care quickly if it's hard to get an appointment in person with your primary care provider, whether it's at the VA or at a VA clinic, or whether it's in the community, because of the Mission Act, which is actually, we're showing that right now, which was passed about a decade ago, allowing people to access care if they can't do so in a timely way through their VA. So that obviously includes veterans and their immediate family members. So the Mission Act has really expanded access to care. And lastly, I'll just say, there's a lot of, sometimes I'm a pulmonologist, I get a lot of this outreach, people that might have been exposed to burn pits on deployment, other toxic exposures. There's the PACT Act, PACT Act, that was passed by President Biden's administration in 2022, basically expanded eligibility and benefits for veterans exposed to burn pits. Big problem during the first Gulf War, and frankly, all the way back to Vietnam, not to some degree in the wars post 9/11, but this is something to keep an eye out on. If you have a loved one that deployed into any of those settings, anywhere in the Middle East, really at any point in time, and may have been exposed to something. This is a conversation to have with them. But if they were managing a burn pit, or if they just felt like they were exposed to poor quality air, sandstorms, whatever it is, and are having difficulty breathing, the PACT Act entitles them to get necessary care to potential exposures during deployments. So it's something that you can advocate for on behalf of a veteran, or a loved one, whatever it may be, that a friend, somebody that's close to you. Even if you aren't related to them, you can advocate for their expanded access to benefits for the specific condition. With that, we're gonna, again, as always, we're gonna summarize that up in a one-pager and make sure you all have access to these resources digitally. But Randy, I'm gonna kick it to you.
So I just would both you and Irwin, I think that both of what you've both said today is that we have to actually recognize the trauma that happens for our vets and that happens to families as a result of war, and not pretend that because people are silent or quiet that these things are not happening. And I think that the real question I have for both of you is, since a lot of people are they're very stoic, or they still want to be, we're not going to say anything, we're not going to do anything, we're going to show that we are macho or that we can take it. How do we get this kind of information out to people? How do we get the warning signs so that people see it? I mean, this happens in so many other arenas, but when it comes to our vets and their families, and Irwin, I think what you said about war in Ukraine is so important. How do we find a way to get the information to people so that we can be the helpers, so we can be the Fred Ruggers? How do we do that?
Well, if I could just try to respond to that, Randy, because listen, right now the chance of this happening on a national level through the efforts of the federal government,
It's none and none.
is there
I'm
something
sorry.
less than none? But yeah,
Yeah.
so right. So that means that we have to think about other strategies, and one of them is there may be state governments, for example, or local community governments that can put out very simple messages. If somebody would produce them, and they may even exist somewhere, and have them be disseminated through other sources other than the federal government, that is one thing. The second thing is that organizations just like the AFT, Randy, can put out the message through your extraordinary channels. Pediatricians should be doing the same thing, and family doctors, and people who take care of veterans. In other words, we have to look for alternate pathways to get this word out. It's doable. It would be really great if it was part of a big, sustained national campaign. But like we're just saying, it's the chances of that happening are not good, to put it mildly. So anyway, that's what I think. There are alternate methods, and listen, conversations like this are also very, very helpful. And then you're emphasizing that hotline for veterans so that individuals know what to do and where they can go. I don't have any idea of whether of how how the responders to that particular hotline are capable. Are they capable of dealing with children? Do they deal with children's issues? I don't have any idea, but what do you think?
Well, I was going to actually, quite short answer is I don't know. 988 is relatively new.
Yeah.
All these new initiatives, I think we're still seeing the impact of President Obama's Mission Act and the PACT Act. And so I do think that these digital solutions are still pretty evergreen. I had a question for you and Randy, not to kind of defer or sort of pivot, but I was thinking schools would actually be an incredible way to engage or families that have veterans that might intersect with the military in
Yeah.
some way to build that awearness. But Randy, I don't know. I'm curious
Yeah. No,
what you've seen. Yeah.
no, I think, I was at Somos this weekend and we were having conversation about AI in one of the panels and about how to get literacy issues out there for parents. And I kept thinking the same thing in terms of schools. Public schools, serve as the foundation of communities in so many ways. And I have watched public schools in Florida, for example, also open their doors so that the health equipment, the gym equipment can be used by community in the after school or on the weekends to serve as a quasi gym. I mean, you think about the infrastructure of a school all dotted all throughout America. And I do think we should be thinking about in a more fulsome way how schools can be centers of community and can actually create this kind of network of information. So I completely agree with you about this. And the real issue becomes, how do we support it? How do we resource it? But I do think that schools can be the kind of center of community for information for families, including families that include veterans.
I should also say, and then I know we're coming up in the top of the hour, so Randy, I'll kick it to you to wrap. First, Dr. Redlener, Irwin, grateful. I think we're going to enlist you for December to talk all things pediatrics.
Yeah.
So you're coming back. I do want to say, just Randy, to build on your last point there in 30 seconds, a lot of military recruitment, it happened to me during medical school, happens in places of education, higher learning. That's where people first learn that this is a possibility, or to subsidize their education is join the military. So I love that there's that plug-in longitudinally where maybe this is a place where people can get exposed, veterans when they go back after their service, on ways in which the VA or the private healthcare system can be helpful to them. So I love that tie-in, because a lot of us enter the military through education. But Randy, anyway, I'll kick it back to you.
So I just really want to say thank you. Look, this is what we're trying to do. We're trying to be a public service. And I thought it was an amazing idea, Vin, to use Veterans Day as, a day where we could educate people who are our members, and sorry, that's my dog that's barking, but our members and people who are interested in this series, educate people about the services that are available to vets, and also even in this moment where the federal government is so retractive, how laws that we've gotten passed over the course of the last few years and ways that medicine is advancing have actually been helpful here. Kelly, if you would put that slide up before we put the Trevor slide up, just on the veterans benefits that Vin had, that would be a good slide to keep up here as I'm talking. Thank you so much. And so I just think that we then did the kind of public service that Irwin was talking about today as a way of honoring vets, to not simply put a social media post out there saying we love our vets, we honor our vets, but how we educate people, particularly in the absence of a federal government that is doing this kind of work. So I really want to just say to you, Vin, thank you for all of your service, both as a doctor, but also also in the military, also in what you do as a, not only what you do as a vet, but also what you do. I'm going to get at the 446th. I love that. I want to know where the 446th Aero Medical Staging Squadron is at Joint Base Lewis McChord. But thank you for continuing to be in the Air Force Reserve, and for both of you, both Irwin and I've watched Irwin and Karen's work in Ukraine. I've been a part of some of it, both the work that you do in America and in Ukraine, the work that you do as a doctor, the work you both do. You provide such an incredible service to Americans and to Ukrainians. And I just really wanted to say, on behalf of the AFT, we really, really appreciate it. So thank you, both of you, very, very
Thank you,
much.
Randy. Thank you.
And for those who are watching, who are veterans, please thank you for your service. God bless you. And for everyone else, have a good day, and happy Veterans Day. And I know Kelly is telling me that I should say this. We have I know this is November. I know we normally have only a monthly one, but we are doing 2 vital lessons this month. And so you'll see in a couple of weeks, actually next week, we're going to do something about how we support the LGBTQIA+ community with some of my favorite people and organizations from the Trevor Project. So see you on November 17th. And until then, Vin, we're signing off, and thank you, Irwin.
Thank you.
Bye-bye.